everyone, welcome to my YouTube channel Physio's Healing Touch. So in this video I will tell you different massage techniques, that is friction massage, effleurage, tapotement and Petrissage. So the part which we have to massage, we will uncover that part first. So here I want to massage on the back, so I will uncover the back. Your hands should be clean, warm and relaxed while massaging. Here I am using oil. You can also use cream or any powder. If patient is very sweaty, then you can use powder because it will absorb that sweat. If you have any rings in your hand, then you have to remove it, otherwise it will be uncomfortable for the patient and therapist. So I am warming up the oil and I am just spreading the oil on the patient. The pressure which you are applying should be not too hard or it should not be too light, so that it produces tingling on the patient. So you have to produce a moderate pressure. So the first technique which I will show you is effleurage. So effleurage is basically given to assist the venous flow or lymphatic flow. So here I am starting my position from buttocks and then I will bring it up to the axilla level.
So to assist venous return, I am starting from distal and then I am bringing my hands to the proximal level. So you have to move from distal to proximal. Initially my hands are flexed and when I move upwards, it becomes extended.
So basically I am applying pressure from the border of my thumb, thenar eminence, hypothenar eminence and the little finger. So I am not applying pressure from my medial 3 fingers, but I am applying pressure from this area.
Apart from assisting in lymphatic drainage, effleurage also helps in relaxing the client through its sedative effect. For effleurage, my position is lunge standing and I am transferring my weight, my body weight from rear foot to my front foot, and I am not producing this effect from my upper limbs because if I will use my upper limbs, then I will become fatigued easily. So I am using my body weight. I can also superimpose my one hand on the another to produce a deeper effect.
Now the next technique that I will use is stroking. So stroking can be fast or slow according to the requirement of the results. So slow stroking is used for its sedative effects and fast stroking is used for its stimulating effects.
Stroking can be performed in any direction, but mostly it is preferred from proximal to distal direction. If you want to perform fast stroking, then you should do 4 strokes every 5 seconds. You can also use alternate hands. Now if you want to perform slow stroking, then you have to perform 1 stroke per 5 seconds to stimulate the nerves and produce a sedative effect.
Now the next massage technique is kneading. In kneading, I will perform a circular motion, and in that circular motion, the half portion of that circle, I will apply pressure, and the remaining half portion of that circle, I will keep it without any pressure. So I will not apply pressure on the remaining half portion of that circle.
Half portion I am applying pressure and on the another half portion I am not applying any pressure, and I am also gliding my hand onto the next area of the skin. I am using the palm of my hand to perform kneading, that's why it is known as palmar kneading. I can also use my fingers, like you can see I am using my volar aspect of the fingers. So I am using my flat fingers to perform kneading. Now I am using my fingertips to perform kneading. Make sure that your nails are properly cut because otherwise you can hurt the patient. In superimposed kneading, one hand superimpose the other hand and it helps to achieve the greater depth. So it can be used in back and gluteal regions. Now we will use heel of the hand to perform kneading. Now we can also use pad of the thumb to produce kneading, and it is mainly used for the narrow small spaces like interosseous spaces. We can also use tip of the thumb, but make sure your nails are properly cut, otherwise it can hurt patient.
Now the next technique is picking up. So in this, I have to put my hands like this, and then I have to compress the tissues, and then I have to slightly pick up the muscle tissue. So I don't have to pick it like this. It will produce a pinching effect. So to avoid this pinching effect, the cleft which is present between the thumb and the index finger, I will keep this cleft remain in contact with the patient's skin so that it doesn't produce that pinching effect. So this cleft will remain attached to the patient's skin. So it will remain on the patient's skin, and then I will compress the tissues, and then I will pick it like this. So you have to pick it, you have to grasp, and then you have to release.
Now the next technique is wringing. In this, I will lift the tissues and then pass it from one hand to the another hand. So in this way, you have to perform wringing on patient. Now next is rolling. In this, you first have to lift the tissues and then you have to roll the tissues. If the skin is adherent, then it might be you cannot lift tissue much, but if the skin is smooth and loose, then you can easily perform rolling. Patient will be in walk standing so that he can transfer his weight. Remember, during massage you don't have to use your upper limbs, but you have to use your whole body weight in order to decrease fatigue.
Now the next technique is friction massage. So in this, first I will tell you about the circular friction massage. In this, I have to create a circular motion, and in this I don't have to increase or decrease the pressure. The pressure will remain constant.
So I am using my thumb to produce a circular friction massage. In this, I am producing a stationary pressure, unlike the kneading in which I have to increase or decrease the pressure, and then I can gradually increase the depth of the pressure in friction massage. We can also use friction massage in case of scars in order to mobilize the scar from its subcutaneous tissue. Friction massage is normally localized, unlike the kneading in which we have to keep gliding and come to a next position. One thing to remember while giving transverse or circular friction is the movement should not take place between your fingers and patient's skin, but between the affected structure and the overlying tissue.
Now the next technique is tapotement. So in this, first I will tell you about hacking.
So in this position, my arms will be slight abducted, elbows will be flexed, and I have to perform repeated pronation and supination, and remember there should be no movement of the elbow. My wrist will remain extended to about 50 degrees.
Now the next technique is cupping technique.
I have to make a cup shape of my hands, and the center portion of my hand should not touch the patient's skin, and then I have to perform repeated wrist flexion extension. There should be no movement of the elbow. This technique is great to remove secretions from the lungs. This technique also increases the local circulation and stimulates the muscle tone and tendon reflexes. If you can also cover the skin of the patient with a sheet and then perform cupping and remove the secretions from the lungs.
next technique is beating.
Now to perform beating, MTP joints will be flexed and PIP joints will be also flexed, but the DIP joints will be extended and patient has to perform repeated flexion and extension of the wrist.
Now the next technique is pounding.
From your ulnar side of your hand, you have to produce repeated pronation and supination. Now next is tapping, which can be performed from fingertips or finger pads. You can see it is mainly used for face. Index finger, middle finger and ring finger is used to perform tapping.
Now the next technique which I will show you is vibration.
For this, you have to superimpose your one hand on the other hand, and then you will be in lunge standing. Your shoulder will be flexed and elbow will be extended. You have to tense your muscles. In this way, you will have to produce a vibratory force. You have to produce a minute flexion and extension of wrist. Rapid and minute flexion and extension of wrist. It produces a compressive force. You have to compress and release using an up-down motion.
Now the next technique is shaking.
You can see on longer muscles I am producing a side to side motion, so it is producing a shaking movement. So that's it for now, and I hope you liked my video. So please like, share and subscribe to my channel. Your one comment and like means a lot to me. It motivates me to keep uploading such knowledgeable videos. So thanks for always loving my content.